Hello everyone, my name is Wen Zan and I'm a transition to practice nurse. Today I will be presenting to the new graduate nurses who are on the same ward with me on the topic of infection control by using personal protective equipment, also known as PPE. Before we start, let me ask you a question first. Have you ever heard a nurse telling you that you don't need to wear contact precaution for patients with MRSA because everybody has it, or we will not touch the patient, so you don't need to put the gloves on? I have heard them several times when I was on placement, and this has always made me feel unsafe to work with the nurse. What would you do in this situation? If you're not sure about this, I hope you will find out the answer by the end of this presentation. According to New South Wales Infection Prevention and Control Policy, PPE refers to the protective barriers that can be used alone or in combination in order to protect our skin, mucous membranes, and clothing from contamination. It includes gloves, gowns, and aprons, masks, eyewear, and facial protection. Personal protective equipment is a key component of transmission-based precautions, but healthcare workers' adherence has been suboptimal. A research conducted in 2 hospitals in New South Wales shows that not so many nurses are strictly following PPE policy. This is mainly due to the fact that nurses are sometimes entering and leaving the room frequently and are required to repeatedly putting on and removing of PPE. The insufficient use of PPE can significantly compromise patient safety by putting them at risk of hospital-associated infection. Hospital-associated infection is one of the most common adverse events for patients, affecting hundreds of millions of hospital inpatients every year. A systematic review of 24 articles on HAIs in Australian hospitals shows that there are approximately 165,000 of hospital-associated infection occurring annually in Australia. It is a major patient safety issue in hospitals, and it is closely related to standard precaution, especially the use of personal protective equipment. The use of PPE can not only protect patient safety, but also our own safety. Research shows that nurses, as part of the front line of healthcare professionals, are also at risk of catching infection diseases. The insufficient use of PPE can compromise occupational health and safety of the workplace and putting everyone at risk, including the nurses, other healthcare professionals, as well as our family and friends. We have been provided with policy and guidelines on infection control and the use of PPE in various situations. The Infection Prevention and Control Policy indicated that the selection of PPE must be based on the risk of transmission and contamination. The Infection Prevention and Control Handbook also explained the suitability of different types of PPE in different clinical scenarios, as well as consequences for putting on and removal of PPE. In hospitals, there are colored cues on the door where we can refer to as well. Infection control, especially the use of PPE, is significant to contemporary nursing practice because it is an important aspect of infection control for nurses. As we talked earlier, the insufficient use of PPE can compromise patient safety and the safety of the workplace. Evidence shows that effective leadership can contribute to resolving this problem in many different ways. A research focusing on connecting nursing leadership and patient outcomes shows that positive leadership can ensure personal work environment that allows collaborative teamwork and decision-making, as well as professional development. Nursing leaders can provide education, supervision, modeling, and embedding policy. We should adapt transformational leadership style to involve others to achieve the common goal. A systematic review on improving adherence to standard precaution in general suggests that following guidelines and policy are the foundation for infection prevention and control. As a new graduate nurse, I will comply with the policy and guidelines such as Infection Prevention and Control Policy and Infection Prevention Control Practice Handbook. Nursing leaders should ensure the distribution of tasks within the team is appropriate and nurses are working in a team. As a leader in my leadership role, I will also provide education to fellow nurses and be a good model in daily life. Research suggests that the use of checklists and colored cues has been successful in improving adherence to PPE as well. Therefore, I will ensure the colored cues on the doors are accurate and supervise other nurses' practice, including other RNs, ENs, AINs, and student nurses. According to Code of Conduct for Nurses, we must provide person-centered and evidence-based care and ensure the delivery of safe and quality care. We are expected to be safe in our practice, which means we should optimize patient health outcome and minimize adverse events such as hospital-associated infections. We have the responsibility to implement policies and guidelines, and when I'm unsure about the selection of PPE, I will always refer to the New South Wales Infection Prevention and Control Policy and the Handbook. By following the policy and guidelines, I'm making the interest of people our first concern and ensuring my practice is safe and effective. The registered nurses' standards for practice can also help us to conduct ourselves professionally. We should think critically, develop and update our knowledge on the use of PPE and infection control in general, and comply with infection control policies and guidelines. Moreover, we should work in collaboration and supervise our colleagues in their practice and ensure we are all providing safe and high standard nursing care. We should also look after our own health and ensure our own safety and healthy workplace. The International Council of Nurses Code of Ethics for Nurses indicated that we must be responsible and accountable in our practice, and always maintain our professional knowledge and practice within our scope of practice. Do you have any questions? I understand that we are all new graduate nurses and we had different experiences on placements before, but I believe infection control and the use of PPE have always been a basic component of nursing practice. Please let me know if you have any questions or need further explanation. In this presentation, I used pictures and audio to enhance understanding. I choose to present the information in this form of presentation is because it is more engaging than simply reading the policy. This presentation targets auditory and visual learning styles with the use of audio and images. Do you still remember the question I asked you at the beginning? Of course, we should always comply the policy and wear appropriate PPE before entering patient's room. Now you know that personal protective equipment is a key component of infection control, but it has a suboptimal adherence in nurses' daily practice. This problem can compromise patient safety and make the workplace unsafe. Effective leadership can contribute to this problem by providing education, supervision, modeling, and so on. Remember, every one of us has a role to play in the battle against infection. This is my reference list. I used peer-reviewed literature and Australian policy and guidelines to support my topic throughout this presentation. The literature used have been official and can be used for continued personal development.